Hey everybody, it's Philly Cuts, coming back at you with an update on my manipulation under anesthesia procedure that I had to get for my knee. I had that yesterday at about 11:30 a.m. I just kind of wanted to give everybody an update and then maybe talk about the process that I went through with that. So I guess I'll start with that. I had to go to the hospital at about, I was told to report there at 11:30 a.m. I got there about 15 minutes early, and they took me in right away. I was brought to a room. I don't know if you've ever had surgery or anything. They kind of put you in this holding bay where there's beds and stuff. I had to go there and get changed into a hospital gown. I had a nurse come in. They shave your leg. So I'll show you guys this. I got this in director's view so that I could switch back and forth. But as you can see, they shaved my leg down. Even though they weren't going to cut into me, I guess they still had to do it. This is a Band-Aid from where the doctor gave me a cortisone injection after the procedure was done. So I had to get my leg shaved. They took all my vitals and everything like that. I had to get an IV. There's the Band-Aid from that. I still got my hospital bracelet on from yesterday. So just had to get those vitals ready. And it took I had to kind of stay there for about an hour and a half before they really brought me in. Because I had to speak to a couple different anesthesiologists and nurses. They just told me how they were going to go about with the anesthesia. I basically got general anesthesia, so I was knocked out. They did have to put a breathing tube into me for this, even though it was a relatively short procedure. The anesthesiologist commented that I have a really small mouth, which I thought was funny. So that was that kind of, I don't know, for some reason that made me feel less nervous. But, I was pretty nervous. I guess any time that you kind of get put under, it can be, naturally nerve-wracking. I wouldn't say that I was as nervous as I was the first time when I had to get the knee replacement surgery. But nonetheless, still was pretty nervous. All the nurses were really nice. Really had good bedside manner and, made me feel at ease and everything. So that was good. So I was brought in to the operating room. And the last thing that I really remember is the doctor and the anesthesiologist putting the face mask over me, telling me to breathe. And then I was gone. And the next thing you know, you're in the same recovery bay area that you were in to start out waking up. So it's kind of strange, man, when you get anesthesia. It's just like you don't remember anything. It's like you get knocked out, and then the next thing you know, it feels like 10 seconds later you're waking up in the recovery area. So the good news is that the doctor said he was able to get my flexion to 140 when I was under. So he said that, it sounded like a lot of scar tissue got broken up, and I was able to get to 140. Now, I was supposed to go to PT later that same day at 3:30, but I was unable to make it. So like I said, I got there at 11:30. I was kind of chilling in that waiting bed area, that prep area, for an hour and a half, so I didn't get in until about 1 o'clock. And then I got out, I think, in about 20 or 30 minutes. I think he said he manipulated it for that long. And it takes a while for you to wake up from general anesthesia. I think it took like a couple hours. So because of that, the PT had to be canceled. And now I don't have a PT session until tomorrow, which will be August 1st at 3:30. So I'm going to have to today do my PT on my own, which I definitely plan on doing, and just going through all the exercises and everything that I have to do on my own today. How am I feeling now after this? So let me switch to here. I feel mostly the most pain I feel right now in my leg, surprisingly, is more in the quads. So I think because they have to so aggressively, bend this thing to get it going, that I'm mostly feeling a lot of pain here, and it just feels, kind of tighter than normal. And then also up through here on my quad. That's mostly where I'm feeling a lot of tightness and everything. When I do start to bend my knee, that's where I'm feeling like most tight actually up here and painful up here. But I can, as you can see, I can bend it back pretty good. I'm not sure if it's over 100 on my own, but it is bending good. Another thing that I noticed too, when I woke up this morning, I didn't feel as much stiffness as I normally did. So that's a positive. Like normally when I first wake up, the knee just feels so like sore, and you feel like a tin man. You feel like you got to get oil into your joints or something to get it going. But when I woke up this morning, it didn't feel as bad. I mean, I didn't feel like I was getting like total movement on the knee, but it didn't feel like as painful in the knee. And I was able to kind of feel like I was walking a little bit better this morning than I normally would have before I had this procedure. So that's a plus. That's a positive that I hope that is maintained while I'm doing this. So I'm feeling, optimistic on that front, that hopefully, fingers crossed, this manipulation is going to work pretty good. Now, from reading that I've done on my own, I heard that even though that the doctor was able to get my flexion under anesthesia to 140, you lose like more than half of that pretty quickly. Hence the reason why you have to go to PT. So the plan is that after I start PT tomorrow, and then I'm going to be going like every day during the week for the next 2 weeks, hitting this hard, with that support, and I'll be getting regular measurements. So, I'll keep you guys posted on that too. I'll go to my first PT session tomorrow and see how that goes. Now, I thought real quickly, maybe I could run through more of the aftermath. So these here are the medications and over-the-counter stuff that I have to use. Basically, acetaminophen, which I've always been using. I got to take like 500 milligrams of this every, I think, 4 to 6 hours, not to exceed 3,000 milligrams in a day. You also have to take Colace, which is a stool softener, because every time that you get a procedure with anesthesia, you run the risk of getting blocked up, and that's kind of like the last thing that you want to have happen is run into a constipation issue after all this. So I've been taking that. I have to take that twice a day. They still want me to take a baby aspirin twice a day, and this is to prevent any blood clotting or anything. I imagine maybe there's a risk of that with them tearing up my muscles a bit to get it to move. So I have to take that twice a day. The other thing that I have here is oxycodone, 5 milligrams. I'm able to take this up to 4 times a day, I think, or every 6 hours as needed. So that's a good pain reliever that I definitely plan on utilizing. My strategy is going to be that about an hour before I have to do my PT for the day, which I plan on doing probably 2 or 3 sessions of PT on my own today. I plan on taking my acetaminophen and my Oxycontin about a half hour, 45 minutes before I intend to do that, because I feel, and I've been told this by my providers, that that's probably the best method to utilize your pain relief for, so that you're able to tolerate the pain more when you're doing your PT and your exercises and you're trying to get, your knee to bend and stuff and to straighten. And then the last thing that they gave me, I have to take this anti-inflammatory Celebrix 2 times a day. So that's an NSAID anti-inflammatory. So the recovery is a bit different than the total knee replacement, because I wasn't allowed to take any NSAIDs after my recovery for the total knee replacement initially. And also, what's different too is that my doctor gave me this cortisol shot. Now, he explained to me that I may run the risk of infection because of this, because I guess it kind of shuts down your autoimmune system a little bit, like your response to things, your response to inflammation. I mean, that's what your body does to help protect itself when it's going through, an issue like this. It gets inflamed. But the cortisol shot's going to retard that response, So he said that there is a risk of that, but he said in the 20 years that he's been doing this, that he's never seen that happen. And he's giving me this cortisol shot, so again, that I'll be able to better tolerate the pain that's going to be associated with doing my PT. So I'm optimistic too on that front, because I have this additional pain reliever in me to help with things. So the other thing that I'm going to have to do too is, so let me get up here. As you can see, my couches are pretty wrecked because I have Labradors. And these guys, no matter how hard I've tried, they want to sit in the window and look out the window. So that's why we got these covers on here. And you can see where they sit. But anyway, so the strategy that I'm going to employ before my PT as well, not only taking the painkillers 30 to 40 minutes before, but I'm also going to put a heating pad on my quad and knee, and to help loosen up the muscles there a little bit. Because like I said, the most pain that I'm feeling right now is really in the quadriceps. And if you look here, you can kind of see, there's my regular knee, but you can see that it's pretty inflamed already. And on this side of my knee, it's really like sticking out, like inflamed. Like, see how this knee is kind of normal and kind of goes in like that, but this one's kind of bulging out. And that's where I feel a lot of pain too right now. I got spots on here because I did get a rash, pretty bad rash, from the steri strips that I had on here when my knee was recovering. So I'm going to wrap my knee in this heating pad for about probably 20 minutes before I start my PT. Kind of get the blood flowing there, get these a little loosened up a little bit. And then afterwards, after I do my PT, this is a little worn here. I got blood on it because from, like I said, I had the rash. I have to ice it about 4 to 6 times a day for like 20 minutes at a time. And you basically use these things that they gave me. Kind of like something that you would find in a cooler. I have 4 of these gel packs, so I'm able to rotate them in and out. I'm using one, so I always have a good supply of things. So that'll be good. The other thing is I'm going to do that afterwards and just keep icing it and hope that helps with eliminating any inflammation. So I feel I'm able to walk pretty good. I'm not like limping right now or anything. I feel like my knee's getting a good bend, so that's good. And I'm feeling optimistic. It does still feel tight, I'm not going to lie, and I know that I'm not getting anywhere near 140 on my flexion. I mean, I think it's a little bit better, but this is definitely going to take a lot of work. It's going to definitely going to be tough. I'm anticipating that, and I'm ready to do that because I want to walk normally, So I'll keep keeping you guys posted. I'm going to do my PT today. Maybe I'll throw up a quick video and let you guys know how I'm feeling and how things went after that. Let me know if anybody else out there is kind of going through the same thing, having to get a manipulation under anesthesia. And let me know how you're doing as well, and then maybe we can support each other and just give each other support. I think that's important. All right, guys, thank you. And I'll keep you posted, and I'm alive. So that's good. I'm valuing that more and more each day. And I'll see you guys soon. All right, take care.